For a newborn assessment, you want to make sure that you check the wristbands, as well as make sure that they have the security one on. You want to make sure that you do have the right patient and that they are secure. You also want to make sure you do hand hygiene, as well as wear gloves, just because you are touching the infant. The other thing that you do want to do is make sure that you have them in an incubator and like with a hat on to make sure that they are warm. For this, I might have to hold the baby up to show what I am doing. Typically, you would obviously have the baby laying down for this, but for video purposes, for you to see what I'm doing, I'm going to hold the baby up so you can see that. So typically we do start from ABCs, which is air, breathing, and circulation. A lot of that pertains to using a bulb syringe to suck out any fluid from the mouth first, and then you do the nares. This is so that they don't aspirate on fluid that they might have gotten in their system from being in utero. The next thing that you want to do is take their vitals. So you want to make sure that their temperature is taken. Typically, we'd like to do it underneath the axillary. So that's just putting a thermometer underneath, just because like you can't really instruct them to keep their mouth closed since they are just born. And usually that temperature is going to be between 97.7 and 99.4. You want to take their pulse, which should be about 110 to 160 beats per minute. And then respirations, you want to count that for a full minute, which should be about 30 to 60 respirations. Typically, they're going to have diaphragmatic breathing, just because they are nose breathers. But you want to make sure that they don't have nasal flaring, because that is a sign of using accessory muscles for breathing, and you don't want them to have any complications with that. Typically, blood pressure we don't take because the baby is so small. It's not usually something on the priority for a newborn. A lot of times with doing a newborn head-to-toe assessment, you want to work from head to toe. It is easier. Like I said, you want to make sure you use hand hygiene and wear gloves. So the first thing I want to do is feel for the sutures. So on the head, you're going to have the frontal, you're going to have the sagittal, and you want to just make sure that they are like open. They might be overlapping because of pushing them through the vaginal canal through a birthing process, if they are going through normal birthing instead of C-section. You're also going to look for the fontanelles. They should be flat. You do not want them to be bulging or like kind of like caving in. So you would have the frontal, which is going to be right below like the frontal bone, and like it's going to be kind of between that and the parietal. So if you look right here, like this is the top of the head, it should be right in here. Like again, it should be soft and flat. And then you have the other one, well, you want to support the baby's neck. It should be right above the occipital lobe and behind the parietal, so it's like the back of the head. And again, that should be flat and also soft. The next thing that you want to do is look at their head, make sure that there's nothing like abnormal about the shape. Sometimes like they can have more of like a kind of football shape head, and you just want to make note of that because there is things that people typically do for that. You also want to measure the head of the baby. So head circumference is from the eyebrow all the way around the head. So and you want to do this in centimeters, just because that's typically what we do for newborns and for any measurements with humans. So if you see here, which obviously you would not be picking the baby up like this, I have it wrapped around the head, and this one is at 33. Typical head circumference is between 32 and 37 centimeters. And this head circumference should be about 2 inches above the circumference around the chest. The other measurement that you want to take is the length, which you would want to make sure that the legs of the newborn are straightened out. You don't want them to be flexed because obviously that gives an inaccurate reading. You want to measure from the top of the head down to the heel of the foot. So again, I would not lift the baby up like this in actual practice, but if you can see, I have it around the baby. And typically the length of it is going to be I don't have that written down. The next measurement that you want to do is around the chest. So you just go around the baby, and again, this is going to be about 2 inches or 2 centimeters smaller than that of the head circumference. So this baby is about 32, which normally for the chest circumference, it is going to be from 30 to 35 centimeters. The next thing that you want to do is look at the overall face of the baby for symmetry. Typically the baby is going to be crying, so what you want to do is use that to your advantage and see if you see symmetry. You want to make sure the eyes are not too small or too far apart or too close together. The pinna of the ear should be in line with the inner canthus of the eye. So if you look at this baby here, it is pretty in line with it. If you want to see that here, it's right here, and it is in line with the inner eyes. And usually if it's lower, it is signifying Down syndrome. Obviously you want to see if there's other things that kind of go along with that indication of having Down syndrome. The next thing that you want to do is sometimes you want to also make sure that the eyes, the pupils are dilating. So what we learned in health assessment is you take the flashlight, which obviously you want to make sure the baby's eyes are open for this, and you would move over and then you would move back, and you want to see if they do constrict, and you want to do that to the other eye, and make sure that is correct. The next thing that you want to do is check their hearing. A lot of times babies are going to have a different reaction to sounds because it's their first time in the real world. So you can do this by snapping by each ear, and they'll make a sudden movement or a reaction to it, and that's how you know. You want to make sure you do it to the other side. You can also clap if you want on either side, whatever, just making a noise for them to react to. So the nose of a baby, usually their face is a little bit flatter. This is for breastfeeding purposes. So the nose should be small and narrow. And usually it's going to be flatter on the bridge. If you look at this baby, it is flatter here. And you want to also check the patency of the nose. Typically it is easier to do this while you are assessing the oral mouth. So obviously with gloves on, like I said before, you would have your finger in the mouth to keep it closed, and you would occlude one nostril and then check to see that they're breathing, and then you do the other. While you're doing this, you can assess the soft and hard palate. You want to make sure that it is intact because obviously that can be like a cleft palate. You also want to make sure that they're having that sucking reflex on your finger, which they should suck on it while your finger's in there. The other thing you want to feel around is on the gums. You want to make sure that those are intact, a little bit softer, but also structure-wise, you want to make sure it's there. You also want to open up the mouth of the baby. It should be light pink in color. And you might see something that's called Epstein pearls. They're small glistening white specks in the mouth. This is a normal finding to see in a baby. Also, sometimes you might see teeth, which usually those end up getting removed from the baby. But that's also something that you do want to note with that. You also want to make sure that the tongue is in midline. And then also that it is freely movable. Sometimes they do clip the front portion of the tongue where it connects to the bottom of the mouth, just so that they can move their tongue freely. Also, this helps with breastfeeding as well in the sucking reflex. Next, you want to look at the neck. So we're moving down on the baby. There should be skin folds within the neck. Obviously, with a newborn, their neck is not going to be able to withhold the weight of their head because their head is a little bit larger for their size. But their head should be able to move. So if you see with this baby, obviously the head can move. But you want to make sure that you also want to palpate to make sure the trachea is midline. Another thing you want to assess is that the clavicles are intact. A lot of times in the birthing process, they can get like fractured during it just because they're trying to go through that vaginal canal, and you want to make sure that if it is, you note that, so that way there can be precautions and interventions taken to make sure that that gets fixed and that people are aware of that. The next thing you want to do is we already did chest circumference, so that's one thing you did for the chest already. The next you want to do is inspect what it looks like. It should be cylindrical and then symmetric. The ribs are typically flexible just because a lot of their bones are not calcified and hard, just because they are still growing. There might be a little bit of protrusion at the belly. Typically we see this a lot with babies. That's just because of the size of their organs and everything, but it should not be very distended. Also with the torso region, you want to make sure that another thing that you might see is that the sternum might be like protruding out a little bit. That is a normal thing to see as well. You also want to measure the nipple size. So the nipples should be about 5 to 10 millimeters in diameter. So you want to make sure that you measure that. This baby doesn't have them, so I can't really say what that size is. But again, it should be between 5 to 10 millimeters. The next thing that you want to do is check their respirations, listen to their lungs and their heart. You want to be able to compare them from both sides. So on the baby, as again, you want to pick the baby up like this, but you want to listen and go here. You lower, go to the other side. When we do the back of the baby, that's when you're going to listen to the posterior side. Just to make sure you can still hear the lungs. It might be hard to hear because they are crying. You also want to listen to their heart, which should be like towards the left a little bit of the baby, but kind of towards the midline. And then you do want to listen to the apical pulse for 1 full minute, because since newborns have abnormal, you want to just make sure you take that extra time to get an accurate reading for that. There oftentimes with babies, you do have murmurs that occur. It's usually not concerning. You do want to note that though, because there might be other indications that go along with that. So you want to make sure you at least put that in your information. And then another thing that you want to do is check capillary refill. We did learn this already in health assessment. You just press on the tip of the fingers as well as the toes. You want to make sure you do every single one. So if you see here, I am pressing on every single one. You want to blanch it, and then it should go back in color very quickly. So I'm just going to do that to all the fingers and toes. And also with this, you can assess that they do have all digits and toes and everything. Obviously 5 on each foot, 5 on each hand. And you want to make sure that they don't have webbing. The other thing that you need to do with the cardiovascular system is check the brachial pulse, which is going to be up here on the baby. So you just palpate right here. Make sure you feel it. And then as well as the femoral, which is going to be up here in like the hip. Usually we just do these two because they're easier to palpate than like the lower extremities. The next thing that you want to do is while you're looking at the hands, you can look at the palmar creases. Typically just one is signifying Down syndrome. So you want to make sure that they do have multiple. If you see on my hand, like I do have multiple of those. That's kind of what you are wanting to look for. Next thing you want to do while you're still kind of listening and moving down is listen to the bowel movements. You should be able to hear them. First bowel movement, which this is how you would test the patency of the anus, is they should have voided that meconium within the 24 hours of being born. So you should be able to hear it. You want to take note of that because obviously we're not going to check the patency of that unless they have not voided within the first 24 hours. Again, I obviously wouldn't hold the baby like this, but you want to listen in the right lower quadrant, and then move up in a clockwise formation. And then the next thing you do, and just like how we did on actual like adult patients, is you want to lightly palpate. Again, starting in the right lower quadrant, and you're going to move in a clockwise formation. You just want to make sure you feel like the liver, spleen, and all of that. Now you're going to look at the umbilical cord, because while we are on the abdomen, you should see 2 of the arteries and then 1 of the vein. Usually it's going to be pretty fresh because they were just born, but within 1 to 2 hours it does start to dry up. But you want to just make sure that like there's no signs of infection, so redness, swelling, any of that, discoloration. So that's one thing you want to make sure of. And then next is going to be genitals. Again, you want to make sure you do have gloves for this. So for a female patient, the labia majora should be covering the labia minora. A lot of times it might be some swelling, but this is normal. Sometimes you can see like thick white mucus, which is vaginal discharge. This is also a normal finding for newborns, just because of like the hormone changes from being disconnected from mom. Sometimes they do have that. For males, you're going to palpate to make sure that the testes are down into the scrotum, just because oftentimes with preterm, they don't always go down, and there's some complications, and usually a physician will have to try to get that to drop back down. You also want to look with the male babies where the urethra meatus is. It should be at the tip of the penis. Otherwise, like there is some complications if it is above or below, and you want to take note of that. Again, like I said, for it is normal to have inflammation in the genital areas. So for males, it would be around the scrotum, and it should also have rugae, which is like those curves in it. The next thing that you want to do is flip the baby over. Obviously you want to make sure that they are secure. So oftentimes with a baby, they are going to have lanugo, which is fine hair all over the baby, but an abnormal finding would be like a thick patch of hair, usually right above like the buttocks region, and that can signify spina bifida. And so if you do see that, you definitely want to make sure of it, because it is a disability and that you want to make sure that you note. You also want to make sure that the dimples are intact. You should see that the spine is in line in the middle, and that also they have well coordinated sporadic movements. And the next thing that you want to do is look at the extremities of the baby. So oftentimes with babies we do see acrocyanosis, which is going to be bluish coloring of the hands and feet. That is normal, but if you do see any other blue colors that are cyanotic elsewhere, you want to make sure you note that, because you want to make sure that the baby's pulse ox is where it's supposed to be. The next thing that you also want to do is make sure that they don't have club foot, which would be the feet inward, which this baby does not. They are where they're supposed to be. You also want to make note of the location of like the extremities. If they're straightened out, they're usually more flaccid and they don't have much muscle tone. So as in this baby, you can see like the legs are flexed as well as the arms. This is good. Usually the wrist can touch down to the arm, which is a normal finding as well. You want to make sure that you also line up the knees. As you see with this baby, the knees are even. And you also want to check for hip dysplasia. So that is going to be Barlow and Ortolani. Usually you do Barlow first, and that is going to be pushing the knees inward and pushing down and back. Next one would be Ortolani, where you push the hips up and out. And with this, you would feel like a clicking if there was hip dysplasia, and that obviously signals that it's not in like the socket. And Barlow is something that will fix that if you figure that out. And then another indication of hip dysplasia is going to be uneven creases on the thighs when you're looking at it on the back side. The next thing you want to do is just do like a neuro and mental status. Obviously, like the baby should be kind of alert. Usually if they're crying, that is a good sign because like they were kind of aware of everything going on. Their resting posture, again, they should kind of be like in the movement of being in like the womb and uterus with like being flexed. Obviously if they're straight, they're pretty flaccid. Usually that's seen with preterm. And also with all that, you would see like the muscle tone if they are like flexed. Next thing you want to do is check the reflexes. This is the last thing we have to do. So if you stroke the side of the face of a baby, which this is going to be the rooting, their face should go towards that and their lips will open for a sucking motion. This is for breastfeeding. The next one you want to do is palmar grasp and plantar grasp. So that's placing your finger around their hand and they would grab it, as well as for the foot, they would grab that as well. And that is a positive result for that. Babinski is something we did learn as well. So I'm going to turn the baby like this so you can see what I'm doing. You would stroke it and the toes should flare out. That is a normal finding with that as well. We already did the sucking and swallowing when we did the oral mucosa. The next thing that you want to do is the walking. So you want to hold the baby securely, and when their feet touch the ground, the foot would lift up as if they were taking a step. The next one and the last one is going to be the Mora reflex. So that is going to be like the startle reflex. So whether you're making a loud sound, which would like obviously startle the baby, or if you're holding the baby like this, kind of like going like this, they should flex their thighs and knees. Fingers will like fan out, and like arms will go up, and like their hands would like make like a C shape. This is everything that you would do for a newborn assessment. But obviously if you find any of these that don't line up with what I said was normal, you would make note of that and then let the physician know. Obviously with leaving, you want to do hand hygiene. Make sure that the baby is in the incubator, warm, have a hat on, and just to make sure that they are safe. And you would make sure that you have the right patient. Thank you.